It's a quiet moment. Maybe you're just relaxing, or perhaps heading to bed, and a thought crosses your mind. Lately, things haven't been quite the same. There's a change, a noticeable difference in something that used to feel reliable, a natural part of life. It's a sensitive topic, one that many men find difficult to talk about, even with their closest friends or partners, and especially with a doctor. We're talking about erectile function, and how changes here can feel deeply personal, even a blow to confidence. For men over 60, noticing changes in erectile function is common, but common doesn't always mean harmless. It's easy to dismiss it as just getting older, or something to push aside, hoping it will improve on its own. But sometimes, these changes aren't just about age. They can be whispers, early warnings from your body that something else is going on, something potentially more serious that needs attention. Ignoring these early signs, hoping they'll just disappear, can unfortunately lead to more significant health issues down the road, not just related to intimacy, but to your overall well-being. It's a painful reality that overlooking these initial signals can miss a crucial window for early intervention. A urologist, a doctor who specializes in men's health issues like this, understands the nuances and the importance of these early signals better than anyone. They know that paying attention early makes a world of difference. They emphasize there are certain early signs of erectile dysfunction that should never be ignored because they can point to underlying health conditions that need addressing. In this video, we're going to look at 3 of those specific early signs that a urologist would urge you not to overlook. These aren't just inconveniences, they are potential messengers about your health. Understanding them is the first step to taking control. So, stay with me as we discuss these important indicators. Watch to the end for something that will surprise you about how connected these issues really are to your overall health picture. Let's start by talking about the first early sign that urologists often highlight as a critical indicator, something that might seem minor at first glance but carries significant weight: the change in the firmness or rigidity of erections. Now, it's natural for things to evolve over time, but a noticeable decline in the firmness needed for satisfactory sexual activity, even if erections still occur sometimes, is a signal worth paying attention to. This isn't necessarily about losing the ability entirely, but rather a change in quality. Perhaps erections aren't as hard as they used to be, or they don't stay firm for as long. This subtle shift might be intermittent at first, maybe only happening occasionally, which makes it easy to dismiss. You might think, oh, it was just a bad night, or attribute it to being tired or stressed. And sometimes those factors can play a role. But if it starts happening more frequently or becomes a consistent pattern, that's when it moves from a potential one-off event to a potential early sign. Why is a urologist concerned about a decrease in firmness? Because achieving and maintaining an erection is a complex process that relies heavily on healthy blood flow. When a man is aroused, signals from the brain and nerves cause the muscles in the penis to relax, allowing blood to flow in and fill the erectile tissues. This increased blood pressure is what causes the penis to expand and become rigid. If the blood vessels supplying the penis aren't functioning optimally, if there's any kind of blockage or narrowing, it can prevent enough blood from entering or staying trapped within the penis to create a firm erection. And here's the crucial part that often gets overlooked. The blood vessels in the penis are much smaller than the major arteries supplying the heart or brain. Because they are smaller, they can show signs of damage or disease, like atherosclerosis, the hardening and narrowing of arteries due to plaque buildup, earlier than those larger vessels. Think of it like a plumbing system. A clog in a smaller pipe will cause a problem faster than a clog in a large main pipe. So, a decrease in erectile firmness can sometimes be an early warning sign of cardiovascular issues that could potentially lead to heart attack or stroke down the line. It's not just a sexual health issue, it could be a canary in the coal mine for heart health. This connection is why urologists and cardiologists often work together, and why discussing erectile changes with your doctor is so important for your overall health. Beyond blood flow, nerve signals also play a vital role. Conditions like diabetes can damage nerves throughout the body, including those involved in erectile function. If the nerves aren't transmitting signals correctly, the muscles in the penis might not relax properly, impacting blood flow and firmness. Hormonal imbalances, particularly low testosterone, can also affect libido and contribute to changes in erectile function, though low testosterone alone is less commonly the sole cause of significant firmness issues compared to blood flow problems. What does this mean for you, practically? If you've noticed that erections aren't consistently as firm as they once were, or if they lose firmness sooner than they used to, don't just brush it off. It's not about judgment or embarrassment. It's about gathering information about your body. Keep a mental note, or even a private written note, of when you notice this change and under what circumstances. Is it always or only sometimes? Does it seem linked to stress, fatigue, or perhaps after a large meal? This isn't to self-diagnose, but to have information ready when you talk to a healthcare professional. Talking to your doctor or a urologist about a decrease in firmness opens the door to understanding why it's happening. They can ask questions about your medical history, lifestyle, medications you're taking. Many common medications can affect erectile function and your overall health. They might recommend some simple tests, like blood pressure checks, cholesterol tests, blood sugar tests to check for diabetes, and possibly hormone level checks. These tests can help uncover underlying conditions that, if treated, could not only improve erectile function, but, more importantly, protect you from more serious health problems in the future. For example, if tests show high blood pressure or high cholesterol, managing these conditions through lifestyle changes or medication can improve cardiovascular health overall, which in turn can benefit erectile function. Addressing diabetes effectively can help protect nerves and blood vessels. Ignoring a decrease in firmness means potentially ignoring early signs of heart disease, diabetes, or other conditions that are much easier to manage and treat when caught early. Think of it as your body giving you a heads up. This early sign isn't about your virility or your age in a diminishing way. It's a functional indicator, like a warning light on a car dashboard. It's telling you to check under the hood. Taking action when you notice this sign, talking to your doctor, isn't about admitting weakness. It's about strength and proactive health management. It's about ensuring you have the best possible health for years to come, allowing you to live fully and continue to enjoy intimacy as part of a healthy life. The conversation might feel a little awkward at first, but remember, healthcare professionals deal with this every day, and their goal is simply to help you maintain your health. Starting this conversation early because you noticed a change in firmness is a smart move for your long-term well-being. It's about giving yourself the best chance to identify and address any underlying issues before they become bigger problems. So, the first key early sign urologists want you to be aware of is that change in the quality, the firmness of your erections. It's a call to listen to your body and seek understanding. Now that we've discussed the importance of paying attention to changes in the firmness of erections, let's move on to the second early sign that a urologist would urge you never to ignore. This one can sometimes be even more subtle and easily dismissed: a decrease in the frequency or quality of spontaneous erections, particularly those that occur during sleep or upon waking. These are often referred to as nocturnal penile tumescence or morning erections. For many men, having an erection upon waking is a regular occurrence, a natural part of the sleep cycle. It happens during REM sleep stages and is a sign of healthy nerve function, adequate blood supply, and proper hormonal balance. It's essentially your body's automatic check of the system while you're resting. A noticeable decline in how often these spontaneous erections occur, or if they are present but significantly less firm than they used to be, can be an early indicator of potential issues. Unlike erections that occur during sexual activity, spontaneous erections aren't influenced by performance anxiety, stress about intimacy, or relationship dynamics. Because they happen when the mind is less consciously involved, they are considered a good gauge of the physiological mechanisms necessary for an erection, specifically healthy blood flow and nerve function. If these natural automatic erections are diminishing, it suggests there might be a physical reason impacting the blood vessels or nerves required for erectile function, rather than solely a psychological cause. Ignoring a decline in morning or nocturnal erections is risky for the same reasons that ignoring a decrease in firmness is risky. It can be a quiet signal of underlying cardiovascular disease, diabetes, or nerve damage that's affecting the delicate blood vessels and nerves in the penis. When plaque builds up in arteries, atherosclerosis, it restricts blood flow. This restriction often shows up first in the smaller vessels, like those supplying the penis. If blood flow isn't sufficient to support a spontaneous erection during sleep, it's a strong indication that circulation elsewhere in the body, including towards the heart and brain, might also be compromised to some degree. Similarly, conditions that damage nerves, like uncontrolled diabetes, can impair the signals needed for spontaneous erections. It's important to understand that occasional absence of a morning erection isn't necessarily a cause for alarm. Sleep quality, alcohol consumption the night before, or even simply not waking up during the right stage of the sleep cycle can play a role. However, if you notice that morning erections, which used to be a frequent occurrence, now happen rarely or not at all, or if they are significantly less rigid when they do happen, that's a pattern that warrants attention. This change is less likely to be purely psychological because it's happening when you're not consciously focused on performance. Think of it as your body conducting a nightly diagnostic test. If the test results, the spontaneous erection, are consistently coming back negative or poor quality, it's a sign the system might need a checkup. Discussing this specific change with your doctor provides another important piece of the puzzle about your vascular and nerve health. They can explore potential physical causes and rule out underlying conditions that are much easier to manage in their early stages. For instance, if high cholesterol is found to be the culprit contributing to reduced blood flow, managing cholesterol can help prevent the progression of atherosclerosis not only in the penile arteries but throughout the body, significantly reducing the risk of future heart problems. The psychological impact of a decline in spontaneous erections shouldn't be underestimated either. While the cause may be physical, noticing this change can lead to worry, anxiety, and a decrease in confidence, which can then further complicate erectile function even when physical ability is present. This can create a cycle where the initial physical issue leads to psychological stress, which in turn worsens the problem. Addressing the potential physical root cause early can help break this cycle and alleviate the anxiety associated with these changes. So, the second crucial early sign urologists point to is that quiet disappearance or decrease in the quality of spontaneous erections, especially morning erections. It's a less visible sign than performance issues during intimacy, but it can be a powerful indicator of your underlying physical health. Don't dismiss it as just a normal part of aging. It's your body providing valuable information. Bringing this up with your doctor allows them to consider potential vascular or nerve issues early on. It empowers you to take proactive steps, whether that involves simple lifestyle adjustments, managing existing health conditions more effectively, or exploring specific treatments if necessary. Paying attention to these less obvious signs like changes in spontaneous erections is a key part of taking charge of your health as you age and ensuring that you are addressing potential issues when they are most treatable. It's about listening to your body's subtle cues. Finally, let's discuss the third early sign that urologists believe you should never ignore, and this one is perhaps the most direct indication that erectile function itself is becoming inconsistent, difficulty achieving or maintaining an erection consistently. This moves beyond just a decrease in firmness or the absence of spontaneous erections and focuses on the reliability of getting and keeping an erection firm enough for satisfactory sexual intercourse when desired. It's not necessarily about being completely unable to get an erection, but rather experiencing frequent instances where achieving rigidity is challenging, or where an erection is achieved but quickly lost before or during intimacy. This inconsistency, this unpredictability, is a key early warning signal. Perhaps it works sometimes, but not others, and you can't quite pinpoint why. Maybe you find you need more stimulation than before, or that distractions seem to derail the erection more easily. This is different from an occasional difficulty due to stress or fatigue. This is when the difficulty starts happening with noticeable frequency, becoming a source of frustration or worry. It might begin as difficulty maintaining firmness, then progress to difficulty achieving firmness at all in certain situations. This waxing and waning can make it easy to rationalize. Well, it worked last week, but the pattern of increasing difficulty or inconsistency is the signal. Why is this inconsistency a critical early sign according to urologists? Because it often reflects a threshold effect. The underlying physical systems, the blood vessels, nerves, hormones, may still be partially functional, allowing for erections sometimes, but they are no longer robust enough to perform reliably under all conditions or on demand. It means the system is strained. Just like a car engine that sometimes sputters before completely failing, inconsistent erections can indicate that the physiological mechanisms are starting to falter. Again, this goes back to the potential for underlying health conditions. Inconsistent erections are frequently linked to early-stage atherosclerosis, plaque buildup in arteries. When arteries are starting to narrow, they might still be able to deliver enough blood for an erection when conditions are perfect, e.g., high arousal, low stress, but they struggle when there's any additional demand or variability. High blood pressure, high cholesterol, and diabetes all contribute to arterial damage and can manifest as inconsistent erectile function before causing more widespread cardiovascular symptoms. Nerve damage from diabetes or other conditions can also cause erections to be inconsistent, as the nerve signals aren't reliably getting through. Psychological factors can certainly contribute to inconsistent erections, particularly performance anxiety or stress. The worry about whether an erection will happen can itself become a barrier. However, urologists stress that in many cases, especially as men get older, there is often an underlying physical component, even when psychological factors are present. The physical issue might be mild initially, leading to a few instances of difficulty, which then triggers anxiety, and the two factors feed into each other. It's crucial to investigate the physical side first, to rule out or manage potential medical causes. Ignoring inconsistent erectile function means potentially missing an opportunity to diagnose and manage conditions like early heart disease, developing diabetes, or hypertension. These conditions, if left untreated, can worsen over time, leading to more severe health problems. Addressing them early, when they might only be showing up as intermittent erectile difficulties, allows for interventions that can significantly improve long-term health outcomes, well beyond just improving erectile function. For example, lifestyle changes like adopting a healthier diet, increasing physical activity, losing weight, and quitting smoking are powerful tools for improving cardiovascular health and blood flow, which can directly benefit erectile function and prevent heart disease progression. Managing blood sugar levels effectively in diabetes is crucial for preserving nerve function and vascular health. Talking to your doctor about inconsistent erections provides them with key information. They can assess your risk factors for cardiovascular disease, diabetes, and other related conditions. They might recommend further tests to get a clearer picture of your overall health. Based on their findings, they can suggest appropriate management strategies, which could range from lifestyle modifications and managing underlying health conditions to specific medical treatments for ED if needed. The key message from urologists is that inconsistency is not just a nuisance, it's a clue. It suggests the system isn't working optimally, and understanding why is vital for both your sexual health and your general well-being. So, these three early signs, a decrease in firmness, a decline in spontaneous morning erections, and difficulty achieving or maintaining erections consistently, are not just minor inconveniences. They are important messages from your body, potential early warnings from a urologist's perspective that shouldn't be ignored. They can be the first outward signs of underlying health conditions that require attention. Remember, noticing these signs is not a diagnosis of doom, far from it. It's an opportunity. It's your body prompting you to be proactive about your health. These are often early indicators, meaning that if action is taken, the underlying causes are often more manageable and treatable than if they were left to progress unchecked. Talking to a doctor, ideally one you trust or a specialist like a urologist, about these changes is the most important step you can take. They can help determine if the issues are physical, psychological, or a combination and guide you toward the right approach. This might involve simple lifestyle adjustments, getting underlying conditions like blood pressure or diabetes under control, or discussing specific treatment options for ED that are safe and appropriate for you. The surprising thing we hinted at earlier, which you might realize now, is just how closely intertwined erectile function is with your overall cardiovascular health. Many men don't realize that changes in erectile function can be one of the earliest signs of heart disease or vascular problems. Addressing these early signs of ED isn't just about improving your sex life. It could literally be about safeguarding your heart and brain health for the future. It's a powerful connection that highlights the importance of listening to your body and not dismissing these signals. It takes courage to face changes in your body, especially those related to such a personal area of life. But choosing to pay attention and seek medical advice is an act of self-care and responsibility. It shows strength, not weakness. Early intervention can make a significant difference in your quality of life, your confidence, and your long-term health outcomes. You have the power to take action. So, if you've noticed any of these 3 signs, changes in firmness, fewer spontaneous erections, or increasing inconsistency, consider it a sign to have a conversation with your doctor. Don't wait. Don't feel embarrassed. This is a common issue, and healthcare professionals are there to help. We hope this information has been helpful and encouraging. Understanding these early signs is the first step towards addressing them effectively. Remember, small changes and proactive steps can make a big difference in your health and happiness as you get older. Have you experienced changes you initially dismissed? Sharing your experience in the comments below can help others realize they aren't alone and encourage them to seek help. Your story could make a difference. If you found this video valuable, please give it a like. It helps us know we're providing content that matters to you. And if you'd like to learn more about men's health, healthy aging, and taking control of your well-being, consider subscribing to our channel. We're always here to share information and support you on your journey. Thank you for watching and taking the time to invest in your health. Live your best life at every age.